because some regions had a large contribution to the database, namely Greater Accra and Ashanti region. And then the last limitation was, in our database, we were not able to find out from the parents what time they started having suspicions as a measure of the actual delay of testing. So we used the age of the child as the measure of the delay. Maybe fed in our future engagements, we might take that data so that we have a stronger outcome. The conclusion from our research was that younger men tend to seek early verification, and this resulted in lower exclusion rates, while older men delayed testing until there was higher rates of suspicion, and that led to a higher rate of exclusion. And then the regional distribution of the testing being concentrated in Accra and the Ashanti region may be as a result of access to testing facilities and then limited awareness and education in those regions outside of Accra and the Ashanti region. So in conclusion, by understanding these patterns, we can better appreciate the importance of timely or early access to reliable DNA testing services. And then the need to provide access to testing services outside of just the main metropolitan regions. Our recommendations from the research is the need to promote early testing and awareness, to expand access and awareness beyond the major cities, and then to integrate counseling into our testing services. Dr. Diasamoah already mentioned the need for mental or psychological evaluation for not just the patients, but even the practitioners in the space. We need to encourage more research within the space. And then lastly, we need to position DNA testing as a health tool and a social tool. I was happy that most of our stakeholders mentioned the fact that DNA testing is not limited to paternity testing. We have testing for cancer diagnosis, cancer screening. We have prenatal testing, which helps us to screen when the mother is pregnant to find out if there are any abnormalities with the fetus. This can be done from as early as 8 or 9 weeks of pregnancy. And once that information is provided to the couple, it helps them to prepare and plan for the baby before they come.